Welcome back to Wedlocked and Loaded.
Wedlocked and loaded.
You women.
Do not lump us all in one category.
So you girls, and lie and stretch the truth
You
and try
girls,
to get us jammed up.
First of all, I'm a whole ass woman, right? Think about
No
that.
disrespect.
Sounds like it to me. So why can't y'all? What is it with men that they just can't walk away?
Depends how good it is. You don't want to give that away.
Actually, Brian, I need to talk to you about.
Boy, he's a hell of a guy, isn't he? He's the one guy I know I can trust.
Brian tried to have sex with me.
Was it bigger than me?
Greetings, everyone. New episode of Wedlocked and Loaded. I am holding it down solo. My name is Daniel Laurent. My boss is not here. I gave her some time away, a little bit of PTO. And I have the pleasure that, this is a conversation that we were supposed to have a few weeks back, I think. But beautiful Boston traffic and my lack of planning changed things a little bit. And so he was gracious enough to reschedule. So I'm so appreciative. We are joined by Dr. Judson Brandeis, award-winning board certified urologist, clinical researcher, sexual medicine expert, and the author of The 21st Century Man. So welcome to Wedlocked and Loaded. Thank you for being here.
Oh, thank you so much for having me. And, it's ironic that someone from Boston actually knows how to pronounce Brandeis.
Yeah.
Right?
Because I've heard different variations for sure.
Well, but if you go out to Waltham, there's a whole university named Brandeis. So.
Yeah, but I've heard like weird. Yeah, it's very interesting. But thank you for being on the show. I think that there is a plethora of things that I want to discuss. And I think, Wedlocked and Loaded, it's not so much of a relationship show, even though we deal with things as a married couple, as friends, as parents, but men's health and women's health also, but she'll do that on her own. It's another show. Men's health is super, super important. I think that for men, there's this thing that has been in existence where we don't check on ourselves. We don't go to the hospital. We might go once a year for a physical, right? And that's it. We're very quick to go get, if we're having any sort of sexual deficiencies, I'll use, right? And I don't know if that's the correct way to phrase it, but if there's any kind of things lacking, we're quick to go to the drugstore, go to, a corner store, Store 24, 7-Eleven, and buy the pills next to the scratch offs, right? And I think that there are some other alternatives with technology and with people like yourself that have dedicated into the science behind. And I really think it's important. And it's not so much a matter of doing things for novelty, right? But it's a real thing that's helping people in a real way. So what I wanted to just kind of frame that.
You bring up a really great point, which is men are 50% less likely to go to the doctor than women are. But even more important than that, men are living less long than we were 10 or 20 years ago. And that's because of alcohol, opioids, and suicide. Right, diseases of despair. So it's really, really important that men begin to take care of their health. And you begin to take care of your health in your 20s and 30s and 40s, but you don't really begin to appreciate the benefits till your 50s and 60s. So when you're 60 years old, you want to look back on your 30-year-old self and say, dude, you really hooked me up. I'm feeling great. I'm trim. I'm still having sex. You don't want to look back on your 30-year-old self and say, why were you out drinking and partying and smoking all the time? Because now I'm 60, I'm fat, I'm out of shape, and I can't get it up.
Yeah.
Right. The time to really get into good habits and to take care of yourself is in your 20s and 30s. Even though when you're in your 20s and 30s, you think you're invincible. You think you can do everything.
Yeah.
Right. Because you can really. I mean, you don't really have to go to your doctor in your 20s and 30s, but there's a lot of things that you need to do so that when you do get into that age, when you're more vulnerable from a healthcare perspective,
Mhm.
you're in great shape.
And I think to your point, there is an invincibility um, uh, mindset of, time is on my side and I have forever. And then before you know it, it's tick, 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 tick. And I think also, let's be clear, and that's not what you were saying at all. And I want to make sure that I'm clear on how I frame this. Just because you are in your 40s or 50s, it doesn't mean that you're old and over the hill. But it's a matter of, look, guys, just be mindful of time flies and what you do today. And it's like planting seeds. I want to
Oh,
just.
I mean, I had a patient on his 80th birthday. He
Mhm.
did 1,100 push-ups in 1 hour. He broke Jack LaLanne's record, right, on his 80th birthday.
1,100 push-ups.
And I had a patient the other day, 91 years old. He asked me if he can get a prescription for Viagra. Right. So if you take care of yourself, you can function at a very high level into your 80s and even your 90s.
Yeah.
In fact, if you're in your 90s and you can get an erection, man, the women outnumber men at that age like 4-1.
Well, okay.
I mean, how great is that?
Well, so let me ask you. So I'm super deviating from, because my first question to you, I'm super deviating, but since we're here, what is the age range or age where typically the erections stop or dramatically slow down, or is that even a way to answer?
Yeah, I mean, so the statistics will show that 40% of men in their 40s have some degree of erectile issues.
In your
50%
40s?
of 50% of men in their 50s, 60% of men in their 60s, 70% of men in their 70s, 80% of men in their 80s, and so on. So just kind of as a rough rule of thumb. I mean, if you're in your 40s and you're diabetic or you're obese or you're a smoker or you're a heavy drinker or you don't take care of yourself, you're going to have erectile issues.
Wow. And
Absolutely.
it's just that simple.
Yeah.
Wow. All right. So that's
You're
why.
not going to be bragging to your friends about it, but
No.
so no one's going to know. You're going to be the guy that's going to puff their chest and tell everyone about your exploits, but a lot of times that's made up.
Wow. Let me ask you, for the audience, what is the upbringing, like, what was the backstory of you coming up? So before, becoming a doctor, right? What Judson's upbringing, like, what were your interests? What were you gravitated towards? Did you want to be an astronaut? Did you want to be a ball player? Did you want to be a star?
So I grew up on Long Island,
Okay.
and I
LI.
I ran track and cross country, and that was back in the day. That was Long Island was like the epicenter of hip hop.
Mm-hmm.
So, Run DMC and Tribe Called Quest and Third Base and LL Cool J and
De La Soul.
De La Soul and Public Enemy, and like all those groups came from within like 10 or 15 miles of where I grew up. So,
Wow.
back in those days, I wanted to be a DJ.
Wow. Okay.
And I even did some radio DJing for a while, but that doesn't really pay the bills. So I ended up going to medical school and then becoming really interested in kidney transplants, which is when I spent a year at Harvard Medical School in the lab where they did the first living-related kidney transplant, and then became really interested in urology. I was one of the first in the country to do a robotic prostatectomy. I built the robotic surgery center at my hospital. I built the kidney stone center at my hospital. I built the MRI-guided prostate biopsy center at my hospital. And then about 5 or 6 years ago, I became really interested in regenerative urology. So having the ability to help men who were in their 40s or 50s or 60s or 70s or 80s who couldn't get erections the way that they used to get them, to help them with technology that go way beyond, the little blue pill.
But I guess, okay, so, and for that explanation, I appreciate. What I want to do is just ask, super, super, super micro level, like, why urology? Like, why not, I don't know, why not cosmetic surgery, or why not dermatology, or like why that? Like what made
Why, you think it's just because I like penises?
No, I think, but you know, even
Yeah,
but even
I'm just playing with you.
no, but even people who are dentists, like what draws you to like someone's mouth of
Yeah,
like,
you know,
you know,
urology is a good combination of surgical procedures and office procedures. So you do
mm,
get patients that, you know, you keep for 20, 30 years, but you also get patients where you just do one operation. You know, they come in with a kidney stone or prostate cancer or something like that. You just see them, take care of their problem, and fix it. So I like fixing stuff. I like it's very rewarding to do surgeries, but it's also rewarding to see patients. And you know, I see guys coming in that are overweight, low testosterone, can't get erections, down, you know, really down, and within 2-3 months, you know, they're totally tuned up. Their testosterone's great. They're getting great
wow,
erections. They're getting back in shape, and their whole life and their whole way that they see life totally turns around. And that's really that really floats my boat. You know, that
that's your
really
reward.
that's the reward that I get.
Okay, because I wanted to. It's okay. So I wanted to make sure I frame that because I think it's always important to know a person's why, like how they got to said point. Um, so I guess before getting to well, let me ask you before P-Long, the P-Long protocol, and we'll explain that. Um, you were voted top urologist in the San Francisco Bay Area for 6 years in a row, right?
It's like 11 or 12 now, I think.
Really?
Uh-huh.
So by San Francisco and so let me ask you. So one,
Yeah, they must have like a Boston magazine where they vote best doctors.
no, they
In the
do,
Bay Area, they have San Francisco magazine and they vote best doctors.
but I mean that's a hell of a run, if I must say so myself. So either A, you are unbelievable, or
I'm
B,
like the Red Auerbach of urology.
fair enough. Okay, because I was gonna say either A.
Sorry, I don't know how many of your listeners are in Boston, but
No, well, I think. Well, I mean, he legendary regardless.
yeah.
So do your Googles, guys, if you don't know. So I guess for that to be the case, because I do know with Boston Magazine, a lot of it is peer recognition, right? So it's
Yeah, it's all
peers recognizing.
peer voting for
Okay,
other peers.
okay. So did you? How long ago was the
I had to pay
protocol?
off a lot of my peers.
Now, okay, seeing you
Hundreds and hundreds of yeah.
wait, so seeing you said that, was it a payoff with cash or procedures?
Yeah,
Wink,
there
wink.
you go.
See?
Well, you know, if you think that the doctors in the Bay Area have larger penises, you know why.
Yeah, exactly. So, yeah, you guys can thank Dr. Brandeis for
Yeah, there you
sure
go.
of that. Let's explain the P-Long protocol. One, before even explaining what it is, like what was the thought behind the name, right? Because I guess you could have came with like something super cutesy, but this sounds very clinical science behind it. You know, like what was the thought behind that first?
Yeah. So, you know, first of all, a disclaimer, like I don't really care how big guys' penises are, right?
Mm,
And I would never encourage someone to do something to make their penis bigger, right? But as a urologist and an expert in sexual medicine, I would see a lot of guys that either had fillers injected into their penis or fat transfers or surgeries and had really disastrous outcomes.
mm,
And as a clinical researcher, like I think I told you, I did research at Harvard Medical School. I did research at American Red Cross. I did research at UCLA. So as a clinical researcher, I always think about problems and what the possible solutions are. And as a regenerative urologist, someone who helps grow new blood vessels in guys' penises, I thought, well, there's got to be a better way. And so I set up a clinical study. I got it institutional review board approved. I had it listed by the NIH as a clinical trial. And then I had the research published in Andrology, which is a reviewed journal. And I presented the results at the Sexual Medicine Society of North America and the International Society of Sexual Medicine. Right. So that's all to say is that this is not some like marketing gimmick
Yeah.
that like, I put a billboard up and I get a bunch of people and then I disappear a couple of weeks later. This is a tried and true method that has been clinically tested on 30 men, with proper measurements and proper oversight by, the urology community. And so this is something real. It's totally safe. And a guy can expect to increase the length of his penis about an inch and about a half an inch in girth. And it can expect to have better function after a period of about 6 months.
6 months. Okay. So, so obviously when the person comes in, there's a consultation, right?
Right.
Is it a consultation followed by, so do you do the consultations yourself? Is it, the nursing staff, and then how does that typically work? If I
Yeah.
walk
I mean,
into your
in
office?
my office, I see all my new consults, but we have I can't see every P-long patient in the country. So we have a network of 50 or 60 trained physicians and providers who can see P-long patients and administer the protocol.
Okay. And then is so from the consultation, like if you walk me through, so from the consultation, um you have to screen out, because not everyone is a good candidate, I would assume, right?
Right.
And so if
But
a person,
it's interesting. It's not just guys with small penises.
no, for
We
sure.
have,
And
we
like,
have guys with
yeah,
small penises, medium penises, even larger penises. And, as long as they're willing and want a bigger penis, we can help them. And we
no,
do it in a way that's totally safe. You don't want to take a perfectly good, the purpose of the penis is procreation and urination. That's it.
yeah,
Right. So you don't want to take a perfectly good penis that's capable of procreating and urinating and mess it up.
yeah, yeah. And that's, what people definitely tend to do with certain things with very, very little regard. Um, so just for the audience to know, because I think, I had a conversation, we've had a conversation with someone in the past, and I think, for guys, I think maybe a little less now, thankfully, because it's a little more of a normal conversation, or it's becoming more normal, and it's certainly in certain circles. But when guys think of anything down there, there's a certain squeamish factor of like, oh, don't touch, oh, that hurts, so whether it's a vasectomy or it's whatever, right? So after you screen and the person's eligible candidate, and you discuss everything, pricing, all that stuff, what is the kind of time frame, what is the time frame from the consultation to the procedure? And is it something where, and I guess my question is a two-part, is it similar to if a person was to go in to get lipo, right? You can't just go and get lipo. You have to fall within a certain thing. So maybe there's some exercise and some weight loss you have to do beforehand, and et cetera, et cetera. Is that part of the process for you, for like a patient?
Yeah. So the process, most men would be eligible unless they've had previous like surgical procedures on the penis that might make it more difficult for
Mhm,
that to happen.
mhm.
But you want to stretch the penis in two directions, right? You want to stretch it in length, and then you want to stretch it in girth. The problem is, like, for example, people get fillers injected in the penis, but
Mhm.
that only increases girth, and it only increases girth in the flaccid state. So basically you have a wide penis with a small head that kind of looks like a pig in a blanket, like those little cocktail franks. Right. And pig in a blanket is great at a cocktail party, but it's not good in the bedroom.
No bad.
So you
Right.
want a symmetric looking penis. And so there's a device that was developed by a friend of mine at the Mayo Clinic called the RestoreX device. And that's the best device for creating length.
Okay.
And you use that 20 minutes in the morning, 20 minutes in the evening. And then there's
Now, is
a
that like a
penis
pump?
pump. Well, there's a penis pump And the penis pump's really good for girth,
Okay.
right? Pulling laterally. And you do that for 12 minutes in the morning and 12 minutes in the evening. So there's a penis extender that you can use, that there was some data published about 20 years ago that if you use it for 8 hours a day for 8 months, you get about an inch of increased penis size. But most people with normal jobs, if you work at Boston City Hall, you can't work in with a penis extending device.
Yeah, that would be in the newspaper.
Yeah.
That wouldn't go over well.
So okay. So you have a length device, you have a girth, and then we use what's called PRP. So PRP is platelet-rich plasma.
Rich
So the
plasma.
platelets in your body have two functions.
Mm-hmm.
One function is to cause a clot, to stop bleeding, but the other function is to cause regrowth.
Yeah.
And so it's a injection of PRP once a month for 6 months. And that's kind of the secret sauce. That and Affirm. Affirm is a supplement that I developed, which is a nitric oxide boosting supplement that basically is a combination of watermelon and beets that contain what's called citrulline and nitrates. And those both basically reduce down to nitric oxide. Nitric oxide is what dilates blood vessels in the penis. So it increases circulation. So when you take it at night, you get better nighttime erections. So you get better stretching at night. You got the PRP, which accelerates both the length and the girth.
And now PRP is most commonly known for hair growth.
Yeah, you can do hair, you can do orthopedics, you can do dental surgery. And then a guy named Charles Runnels injected it into the penis and also the clitoris, so called the P-shot and the O-shot. Wow. And so we basically use that PRP technology that's pretty much becoming ubiquitous in most medical fields to help accelerate the growth of the penis.
And so it's a 6-month commitment, right? Doing the procedure.
Right. Well, so, when you do a clinical research study, you have to stop at some point.
Yeah.
And so at 6 months, I had a statistically significant improvement in length and girth and function. And so at 6 months, I said, okay, we're done. Okay. But I had plenty of my patients that were in the study continued beyond 6 months and continue to get gains. So, if you're 5 inches and you want to get to 7 inches, it's not going to take 6 months. It may take 2 years, but if that's what one of your goals in life is to have a 7-inch penis and you have a 5-inch penis, it's going to take. I have a little calculator on the p-long.com website that will tell you, approximately how many months it's going to take for you to achieve your goal. And then, I had a patient a couple of months ago who, was doing really great. And he said, Doc, I'm sorry, but this is my last treatment. And I'm like, oh, how come you're doing so great? He's like, well, my wife said I'm too big for oral and I'm too big for anal, and I need to leave at least one orifice open.
I love it.
Some of the P-long patients have those kind of problems too.
That's a good problem to have. It's a good problem to have, Doc. So you have, from what I'm reading, you have over 25 years experience, right?
Yeah, hard to believe, but yeah.
Because you definitely are. What I love is for anyone, whether it's a trainer, makeup artist, hairstylist, it's nice when the person is working on you is resembles you know what I mean? And so granted, you can't walk into a room like this with your stuff out, right? However, you look healthy, and like there's some sort of routine and maintenance that you're doing that is like, oh, okay, all right, I don't know how old he is, but I like that. So
I can I give you my routine?
Mm-hmm.
I'll give it to you in 10 seconds.
Mm-hmm.
So if you do these 10 things, you'll be healthier than 95% of men. Okay. Don't drink, don't smoke, don't do drugs, don't eat too much, exercise every day, stretch every day, do yoga, get enough sleep, be nice to other people.
Wow. Easier said than done for
Yeah.
some. However,
It's also
um,
pretty inexpensive.
no, very much so, because everything that you have mentioned, with the exception of sleep, but then depending on whatever. But the drinking is I've had a lot of conversations with people, and it's not until, because I've done like a detox, right? And just kind of going X amount of time, because I'm not like a heavy drinker, but like every now and then. However, you don't realize until you are not drinking just how much people are drinking.
Oh yeah. Well, the thing
And
is, drinking, it's very entrenched in our society, right?
mm,
There's advertisements, and when you go with your buddies to the game, you drink beer. When you go out to dinner with your wife, you drink wine. When you
yeah,
go out with your buddies to the bar, you drink, spirits.
yeah,
But let's just and some people say, oh, red wine increases health. All that is bullshit. Okay, there are all these studies that are coming out now that say no alcohol is good for you.
mm,
Okay, let's just be perfectly honest. Alcohol does three things. It's a depressant. So if you look at the class of drug that it's in, it's a depressant. Second
mm,
of all, it disinhibits you. Okay, so let's be honest. Most of the stupid stuff we've done in our life has been under the influence of alcohol.
fair.
And it's empty calories, right? So
Mm,
it's calories with no nutritional benefit. So if you do the math, if you drink a glass of red wine every night for a year, it will put about 13 pounds of fat on you,
wow.
right? So 2 glasses of wine every night, 26 pounds of fat. If you just add up the calories, 125 calories times 365 days divided by 3,500 calories per pound of fat, it's simple math,
Wow.
right? So, no one, every once in a while I'll drink a little bit, but no one can ever tell me that there's any health benefit in any way, shape, or form of drinking alcohol.
So you don't go for the gluten-free alcohol and all that. I know. Well, yeah,
There used to be advertisements about how healthy cigarettes were.
I remember. Yeah,
I
yeah,
mean,
exactly.
it's no amount of alcohol is healthy. It might be fun, you might enjoy it, but
No, for sure. But there's a
it's
difference, and I think it's important to be honest with ourselves. And so I love that you said that. I love that you said that. Um, I want to ask. So I said this earlier in your introduction. Board certified. Now, I worked at a dermatologist's office, over 10 years. Very, very well known, highly respected, and, brilliant minds. And they were all board certified. So I grew up not grew up, but I grew up matured in a space where that was normal for me. And I know the difference between board certified and not board certified. But for people who don't know, and are just kind of going around shopping, looking for pricing and finding the best pricing, and Dr. Brandeis's just regular numbers, right? No science behind this. Dr. Brandeis is $5,000, and Dr. Washington is $1,100. I'm going to go with Dr. Washington because this is what my budget can afford. However, that non-board certified doctor is probably going to have you
hang
end
on,
up
hang on.
going to see.
This is the penis that you want to go to the $1,100 doctor. You want to trust your penis to the cut rate guy? I just want to be clear.
Yeah. Fair enough.
Okay.
Fair enough. Well, so, but even just speak to, from a medical professional, speak to the importance of board certification. Even when people go to med spas,
Yeah, I
get
mean,
both.
the thing is, like, I mean, in any given specialty, probably 80 or 90% of the people that finish residency are board certified.
Hmm.
Right. So if you're going to someone that's not board certified, you're going to someone at the bottom of the barrel. Right. I
Simply
mean,
put.
that's just pretty
Simply
much.
put.
I mean, if you're going to bring your car in, say you have a Mercedes, and you can bring it to a Mercedes certified mechanic, or you can bring it to someone who, may see a couple Mercedeses every year.
Exactly.
You
That's
know,
a perfect
and
analogy.
if you want to save money, that's great. But then when you're stranded on the roadside, you know, are you really going to be counting the money that you saved? Going to the non-certified.
Exactly.
But I think more important than that,
Hmm.
and I have this in my book, and I have some videos on this, is your approach to going to a doctor, right? Like when I go to my lawyer is $750 an hour. I maximize every minute of my time because every minute in there is like a sandwich to me. Like I just see sandwiches stacking up every minute that I'm there. So when you go to the doctor, if you look at, there was a study by Cerner, which is an electronic medical record system. They looked at 100 million doctor visits, and it's 14 minutes you get to spend with the doctor. And that's not even, like all the time you get with a doctor. So in 14 minutes, your doctor has to take a history. They have to examine you. They have to figure out what's going on with you. They have to formulate a plan. They have to write prescriptions, and they have to explain all that stuff to you.
Yeah.
Right. That's not going to happen in 14 minutes unless you are prepared when you go into the doctor, meaning that you write down your health history. You write down your history of present illness. So I'm here for a back pain. The back pain started 3 weeks ago. I had a similar back pain 2 years ago, and this is what happened. I used this medication to help with the back pain. I did these stretches. This is the imaging tests I had. These are the lab tests that I had. And then these are the questions that I like you to answer. And you take that piece of paper and you hand it to the doctor. Right. And so then the doctor doesn't have to waste time taking a history. They can just ask a few pointed questions. They don't have to go scrambling around telling their staff to look for imaging tests. They can spend time formulating a plan, talking to you about what the problem is, and answering your questions. And so you walk out of there, complete.
It's productive.
And so it's really, really important not just to go to a board certified doctor, but go prepared. And when you go prepared, you're going to get the most out of your visit.
Very important. Very well put. Thank you. And I think that is the first, because again, being on the other side of it, more administrative and that type of thing, I have certainly heard it in a different way. But I think for people going as patients, I've never actually heard it articulated that way. And so thank you for saying it that way, because I do think that either people go to doctors not being truthful, which doesn't help anyone, right? If they ask you, do you smoke, and you say no, but you smoke every day, right? Or when's the last time you had a drink? Well, 3 months ago, when it was really this morning. But also people just think doctors are miracle workers, right? And it's a science behind it. And I think the data is super important. So I love that you said that. So I want to ask you, so you're the author of 21st Century Man. A little before we started the official conversation, we were talking about the book, and I want you to tell people, what is the book about? Why is it so important? The contributors, all the information about 21st Century Man.
Yeah. So, this is the book that every man over the age of 40 should read. And it's written very specifically for men. So, what I can't stand is I read a 300-page book, and at the end of the book, I'm like, there were about 4 pages of information in that book. This information is incredibly information dense, and it's divided up into 101 chapters. So, if you're having prostate issues, then you read the 8-page prostate chapter, which is totally information dense and tells you everything you need to know about the prostate cancer, enlarged prostate. There are 60 other medical professionals that have contributed to the book, and it's about physical health, it's about specialty health, it's about aesthetic health. I have dermatologists, plastic surgeons. It's about health insurance. There's a whole amazing section on health insurance. It's about addictions. It's about then there's a whole section on sexual health and sexual medicine. You name it, it's in there. Every aspect of health, including lifestyle, including leaving a legacy, inspiration.
Wow. Now, do you, is there anything, because I know you mentioned this earlier, is there anything about holistic approaches, whether it's yoga or
Yeah, there's a chapter written by Dean Pullman who does man flow yoga. So he's the
okay,
top yoga for men guy, and he wrote a chapter on mindfulness.
I love it. Okay. All right. And is it available on your website?
Yeah, if you go to, I have a supplement company called Affirm Science, which makes men's health supplements. So if you go to Affirm Science, AFFIRM science.com, or if you want to learn more about the book, if you go to the 21stcenturyman.com, all written out in letters.
Okay.
And then you can buy it there. You can buy it on Amazon. It's on Audible. There's ebooks.
Oh, so it is on Audible.
It is on Audible. Yeah.
Okay. All right. Because I found myself, yeah, I try to go back.
I think it's 35 to 40 hours.
Okay. But
it's a beast.
Let me ask you this: is the idea behind is the idea of putting the book together more of a guide for a person to listen to it or read it straight through, or more so
No, it's a pick and choose kind of thing.
Okay, perfect.
The thing is, like, if you go, like, guys will get medical issues, right? And then you go to the doctor, and then you get referred to a specialist. And the first visit to the specialist is them basically explaining what's going on with you. Okay.
Yeah.
You can skip all those steps and read the chapter.
I love it.
Right. And it's written in a very sort of conversational way. Like if your next door neighbor was the top dermatologist in Boston and you went over one day and asked him a question, this is the answer that he or she would give.
I love it. I love it. Okay. All right. And I'm going to make sure I put, you might've just asked, so pardon me. Is it available in digital form also, like the download, or just, okay.
Yeah, you can download it also.
Perfect. Okay. All right. So as we are closing, I wanted to also, let me ask you, because you are in San Francisco Bay Area, and I know you have different providers throughout the country. Do you have anyone in Boston or in Northeast or New England or?
Yeah, I do. Dr. David Cunningham is in Massachusetts.
David Cunningham. Okay.
And I have a couple of providers in New York.
Okay.
Anywhere there are small penises, we're at.
See, I'm trying. Okay.
I'll tell you a funny story. It was like, we did this and, we wanted to publicize it, right? Because you have to, if you have something amazing, you have to let people know about it, right? So we're looking at Google keywords for Google searches and stuff. So we're like, okay, big dick, big cock, little cock, so on and so forth. And one of my patients was in the office, and he's like a gay man from San Francisco, and he's like, oh, what about dicklet? I'm like, what's dicklet? He's like, oh, that's what we call Asian guys with small penises.
Dicklet?
Dicklet, yeah. So we actually put that in our search terms, and sure enough, we got a number of hits on dicklet.
Like chicklet?
Yeah, like chicklet, but with a D.
Holy granola. Okay.
I need a strange life.
Okay. All right. So I wanted to all right, so I love that what you said in the beginning about you could say everything in 10 seconds. What would you say to a person that's hearing this and just on the fence and still kind of just self-conscious about the idea of talking to anyone about said concern? Like, what would you say to that man? Or let me give you both. So what would you say to that man? What would you say to their partner who is on the receiving end of said concerns? And how should they broach this to their partner?
Yeah, I mean, a lot of times it's not the partner that drives this. It's the guy's insecurity. Maybe somebody said something to him in a locker room growing up, or maybe he's comparing himself to other guys, or maybe people are watching pornography all the time now. So maybe he's watching pornography and there are guys with big penises and he's concerned that he doesn't have big penises and he can't make women scream like the guys on the pornos do. And so, at the end of the day, don't do something stupid that'll mess up something that's perfectly normal and healthy. And the other thing is, right, your partner probably cares more about your self-confidence than they care about the size of your penis. So if you come in there and you have a pig in a blanket penis because you got a bunch of fillers injected into it, they're going to look at that and say, what is that? And why on earth would you ever do that? Or you get a pneuma or a implant and they're like, what is this big silicone taco sitting in your penis for? Like, you had a perfectly normal penis. What's wrong with you? Why are you doing this? It's the self-confidence, I think, that's more important than the actual size of the penis. And so, my first thing would be figure out why you're actually interested in doing it. But then if you are still interested in doing it, and 300,000 women get breast implants every year and not all of them have cancer. So, there's nothing wrong with doing that, but then do something like P-Long, because you can't hurt yourself.
Yeah.
All those other ways to increase the size of the penis, you can hurt yourself. You can really do some damage. With P-Long, go to p-long.com, read up on it, read the paper that I published in Andrology. There's a bunch of lectures I gave, all the information's there and it's all legit and it's all been, legitimized and verified by other urologists and professionals in this field, right? I don't want guys to hurt themselves. If you want a bigger penis, do P-Long. It's safe. It's effective. You won't get these ridiculous marketing gizmos that say, have a 12-inch penis in 3 months. You're going to grow your penis about 15% in 6 months. That's realistic. That's what's probably going to happen. If you want to have a 12-inch penis, you're going to have to be at it for 5 years.
Yeah. What's the guy's name? What's his name? Jeremy?
Judson.
No.
Judson Brandeis.
No. I got it. Okay. Fair enough. Okay. So, and it's the last thing, because everyone's concerned with this, and if you do not feel comfortable completely, you can not say, is there either a range or is there a starting point for people to know budgeting wise? And there's two parts. Do you do I forgot what it's called, clinic care or whatever it is, where people can
so it's up to the individual offices. So I can't tell you what other people charge, but I charge, it's about $6,000 for about 6 months, which if fillers, you're going to charge about $10,000 for the first visit. That'll last about 2 years, and then you're going to have to re-inject every 2 years at about $2,500 a pop. And then the surgeries are at least $20,000. So, at $6,000 may seem like a lot for some people, but relative to the other penile enhancement technologies, it's actually very reasonable.
No, for sure, because the number is definitely okay. All right, and the question about the care credit, that's what it was.
Credit.
Yeah. Do you take, or is it just kind of flat out, or do you do?
Yeah, I personally, in my office, we don't do that.
Yeah.
But I had a guy who was in the other day for erectile dysfunction, and he didn't have his wallet on him or something like that. And I told him that my checkout girl, I was like, oh, well, why don't you take his penis as collateral? But the guy was quicker than me. He's like, well, it's not worth very much now anyway.
Holy shit. I love that. And as the way, okay. So again, I'm gonna take I'm gonna make sure I put like the links underneath, because it's important. And that men's health is super important. And I love that you are being intentional in a space of men helping themselves in a real way, in totality, not just focusing on novelty and it's a real effort. And I think education is super important, which obviously you have cut your teeth over 25 years of focusing on these areas. And so I thank you. I appreciate, the time of speaking. And my hope is that if there's someone who has, question. So, oh, sorry. Very last thing. If there are people that have questions, and not so much questions that you would get in the consultation, is there an email on your website? Is there a chat? Is there a frequently asked questions link?
Yeah, so I mean, the 21st Century Man's got the answer to pretty much any question you want, but also my website, if you want to see me as a patient, is brandeismd.com, brandeismd.com. And we do, I do second opinions from around the country, around the world, for people that have, very specific questions that, their local guys can't or gals can't answer. I also have a YouTube channel with like 100 videos. And I have an Instagram that, I don't know how to use Instagram, but somebody posts for me. And yeah, you can't know everything.
Yeah.
And
yeah.
And let's see, Affirm Science is my award-winning supplements. I have a nitric oxide boosting supplement that boosts circulation. I have a testosterone boosting supplement called Support. I have a supplement called Prelong for premature ejaculation, and I have one called Spunk that's for prostate health.
Oh, is that what's behind you?
Yeah, those are my supplements.
So premature. Okay, because that's a thing.
Yeah, that's a quarter of men have that, but if you ask men, nobody has it.
Yeah, no one has it, and they last all night.
Yeah,
I've heard those stories.
Yeah.
So again, Dr. Judson Brandeis, thank you so much. And this is an episode of Wedlocked and Loaded. We appreciate you being here, and we look forward to having another conversation, because I would love to not just have one and dones. I think
we just kind of scratched the surface of what we all need to know about men's health.
I had a joke, and it like left me. I had like a little one-liner, and it just, because I'm trying to stay on like the straight and narrow, but I typically have a lot of dirty
oh man, well, I don't have a joke, but I can tell you about a patient I saw last week. Do you have a couple minutes?
Yep, you got.
Oh, it's so horrible. This guy was in a horrible car accident, and his penis got chopped off. So he came to see me a couple days later, and he's like, "Doc, how can I get my penis put back on?" And I said, "Well, I got 3 different options for you. I could put a regular one back on. I could put a large one back on. The regular one's $5,000. The large is $10,000. And then I have the large vibrating one, but that's $25,000. That's a lot of money." And so he's like, "Well, I really got to think about it." And so then I didn't hear back from him from a couple of days. And so my office girls are like, "Well, why don't you call Mr. Jones and see what's going on? Because he doesn't have a penis." And so they got him on the phone, and I was like, "Oh, Mr. Jones, I talked to you the other day. You lost your penis, and I offered you 3 options: the regular one, $5,000; the larger one, $10,000; or the deluxe vibrating version for $25,000. Have you figured out what you want to do?" And he said, "Well, I talked to my wife, and she said she'd rather redo the kitchen."
I love it. On that note, this has been an episode of Wedlocked and Loaded. Thank you so much for listening, everyone. Definitely like, share, comment, and ask us questions. We'll forward it to the good doctor if you so inclined. Thank you again, Dr. Judson Brandeis.
Oh, my pleasure. Thanks a lot.
Wedlocked and loaded.